Researchers say 1/3 of survivors are diagnosed with a neurological or psychiatric disorder within 6 months. The Oxford University study dealt with more than 230,000 patients, so this is a massive study. Of the 14 different disorders that were looked at, anxiety, depression, the most common. Post-COVID cases of stroke, dementia, other disorders were rarer. Researchers say they were still significant, especially in those who had severe cases of COVID-19. For more on this, let's go to the UK. I want to bring in Maxime Taquet. He's co-lead on the study we're talking about, psychiatrist at Britain's Oxford University. Maxime, good to have you with us here in Canada.
Good to be here.
All right, tell us a little bit more about the findings here, the key takeaways people should know about.
Well, as you said, so what we found is that in the 6 months after receiving a diagnosis of COVID-19, about 1/3 of patients will go on to have a neurological or a psychiatric diagnosis. And the most common of them, as you said, are anxiety disorders and mood disorders, which is predominantly depression. But there was also an increased rate of neurological disorders and more severe psychiatric disorders, such as psychotic disorders, a stroke, or a brain hemorrhage. And those are concerning findings.
Tell me as well about the correlation between the severity of COVID-19 in these people.
So for most disorders, what we found is that the most severely affected patients with COVID-19, so for instance, those that need to be admitted to a hospital or to an intensive care unit with COVID-19, have more chance of developing those consequences. And that certainly is true for things like a stroke, for instance, where we go from 1 in 50 patients overall having a stroke after COVID-19 to 1 in 11 if we only look at the most severely affected patients.
And I'm curious about, when you talk about anxiety or depression, Maxime, I mean, how much of that is also related to just having lived through this and in some cases still dealing with some of the physiological after effects? We hear about these so-called long haulers that have problems well after COVID is gone.
You're right, and there's certainly an overlap with that area of research about long haulers or long COVID. And certainly there is a psychological effect of having COVID. And we think that's part of the mechanism by which COVID might lead to those disorders. The other part might be biological mechanisms. We know that the virus can enter the brain. We know that inflammation can cause things like depression and anxiety in the brain. So that might be another mechanism. But certainly we are of the view that the psychological stress must be a very important factor as well.
Based on this research, this extensive research, and all the people that were part of it, I mean, what can we take away from it, Maxime, in order to try and deal with some of these issues?
Well, I think on a personal point of view, if patients do suffer from those consequences, they should know that they are not alone and that this might well be related to their COVID-19 illness. On a more health point of view, I think we need to be ready to face the increased demand for those disorders, so in mental health and in neurological health in particular, and be able to provide the health services to diagnose those disorders, but also to provide the right treatment for them.
Maxime, wonderful to have you part of our conversation here in Canada, and thanks for taking some time for CTV News today.
Thank you very much indeed.
Maxime Taquet joining us from Oxford in the UK.